Our focus today is on the booster doses. Remember, this opens up for everyone above the age of 18 tomorrow. Now, just a day before precautionary doses became available to all adults in India, the prices of both Covishield and Covaxin have been slashed by more than half for all private hospitals. Now, the price of Covishield has been cut down from 600 rupees to 225 rupees per dose. Covaxin as well is down from 1200 rupees to 225 rupees per dose. Now, while opening up of the boosters as well as reducing the vaccine prices is, of course, a very welcome move, the big question really is whether this is really boosters for all adults. What about all of those who cannot afford this cost? What about the areas where private hospitals are in shambles or, in fact, there are none? Is simply reducing the cost of vaccines enough? Should we be doing more? Those are the big questions that I'm going to talk about for the next half hour. And joining me to talk about all of this, Dr. Kaushal Mishra of the BJP, in fact, Dr. Ishwar Gilada, infectious diseases expert, and Dr. Sunila Garg, member of the Lancet Commission COVID Task Force, is joining us here on the broadcast. Thank you all of you so much for joining us. Dr. Garg, let me start with you in terms of, your perspective with regard to this, the way this policy is being rolled out for the boosters, with only paid boosters being available right now. What's your perspective? All right, I think we
program,
Yes. Yes, Dr. Garg, I can hear you. Please go ahead.
So I said that the vaccinations which are available, under the program are also provided, free of cost from the government facility, but at the private facilities, they are charged. Number one thing, we have to remember that. But you see, now the time has come where you see we have to rise up, as a part of community participation as well. And, the government has just opened up, with regard to booster doses vaccine, which is a very welcome move. And the costs have also been subsidized. As we go ahead, the situation is going to change. That is important, what we have to remember. But as of now, what I have to comment is that two primary doses or two doses which were there, along with most of us, as Dr. Gilada will say, that, variant, Omicron, which acted as a variant of concern, was a variant of support for us. So all of us have got two doses of vaccine. We have also suffered from infection. So, people who are above 60, they are the ones who are most, in need of the booster doses of vaccine, or what we call it as precaution dose. So they are the ones who are being provided free of cost, and the healthcare workers and frontline workers as of now. So what I will like to say is that the time has come where, the public also should rise up to the occasion. The private partners have to rise up to the occasion because the government has gone a long way in supporting this program. And that's why we are more than 185 crore vaccinations that have been done, across. So you see, as the time has moved, we are going ahead with the vaccination, different phases of vaccination. And we also have got now basically 4 vaccines which are already there. And the Sputnik has not worked that much for us. But then, we have to see that we must rise up to the occasion. Thank you.
All right. Dr. Gilada, coming to you here, not at all to take away from the achievements that we've made as a country as far as the vaccine drive itself is concerned. But the fact here is that whatever said and done, right now, there is no choice being given to a certain section of society. They cannot afford it, so they will not have the choice to go and get the vaccine, the booster.
Yeah, only you and me, we are doing that job. This is maybe a weekend confusion. The government will come out on Monday itself that it will be available free of charge at government, and those who cannot want to wait to at the government center, they can take in the private. Since the beginning, we have been telling that we must have 2 different channels. Not everybody in the country is expecting a free vaccine, and not everybody can afford. So since beginning, we should have started these 2 channels, but somehow the vaccine ownership was only with the government. And second problem was that we did not allow vaccination at the private doctor's clinic, at nursing homes. And therefore, we created a special vaccination centers on one hand and did not utilize the facility which is available already on the other hand. So now this will open up that the private vaccination center or private clinics or nursing home, they can start the vaccination And thankfully, both the vaccine manufacturers, Covishield as well as Covaxin, they reduced the cost. I think this is one of the best moves one could have, because they also are not going to utilize all the vaccines what they have produced. Most important, another thing, Government of India has paid 1,500 crore to a company called Biological E in June 2021, and the vaccine was to be made available in August, and that was for 30 crore vaccines, and that was at the cost of 50 rupees per vaccine. Where is that vaccine? The Government of India's money, 1,500 crore, was paid from our state exchequer. I have not seen one single person who have received one single dose of Coronavax, which is made by Biological E. So I think we should audit all these things. What has happened? Why the vaccine has not come in last 6 to 8 months? Whether there was some mistake in giving permission to the vaccine manufacturer? Whether there is a mistake by giving 1,500 crore as advance payment to them? So we should also look at this issue. So currently, what you see on your vaccine menu, there are 9 vaccines available. But in reality, there are only 2 vaccines available. So when you go to a restaurant, you order for something, no sir, that is not available, that is not available. So only Bharat Biotech's Covaxin and Serum Institute's Covishield, they are available, all other vaccines are not available. So either we should withdraw those licenses, or we should ask those companies who have got the licenses why they are not providing. And lastly, there are too many committees in the government. And when there are too many committees, there is a confusion. So DCGI or CDSCO gives a license, but thereafter NITAGI decides whether the vaccine should be given or not. And there's a lag time of 4 to 6 months between this. And that is criminal. We cannot have that kind of waiting. Either you don't give license, and if you give license, and if it has been already proven to be effective, it should be started using. So why 4 to 6 months are required for NITAGI to give that kind of thing? We have been demanding that 60 plus people were given booster. That was 3 months before. And 45 plus people who are having comorbidity, they are not given booster. The second highest death rate is amongst 45 plus morbid people. So 60 plus, yes, highest death rate, but 45 to 60 with comorbidity, second highest rate. Almost 28% of the deaths are in that age group. So I think in that sense, we should have looked at that, but nobody was giving any heed. And it is like either you give it to all or none, that kind of phenomena. We should have started step by step, 45 plus,
right,
and then 18 plus. But at the same time, whatever is started is good. We have done a best job. We have controlled COVID in a very good way. Our national cases are currently 1,000 per day or so, which is can be seen could have been seen in one ward in Mumbai. So we have the national figure at that level, and we are not bothered about whether it is escalating in east or west. India is the best.
All right, fair enough, Dr. Gilada. Let me take it across now to Dr. Mishra to understand, Dr. Mishra, whether it is just a question of a few days lag before this is going to be opened up, and the same free schemes at the government hospitals is going to continue. What is the reason behind this method of going ahead with the boosters, where only paid boosters are available right now?
Whatever government is doing, it is basically on the advice of advisory group. COVID advisory group is there. Whatever they advise for the betterment of the whole country, we are doing that. And one thing in near future, I think with the advice and with the availability of other medicine, now it's too cheaper and maybe provided free also. But yes, in near future, I can see that those patients who are high risk, those are healthcare workers, they have already given the third booster dose, but for the free everybody, I think the COVID group will take up this matter, and whatever they advise to the government of India will follow the same thing as we have done in the past 2 years for the COVID. We have seen that all the vaccination of the COVID till the time given free, but it's about booster. And if the COVID expert group advises that, then we will do probably the same thing.
Right. So, Dr. Mishra, are you saying that the advice has been to open up only for paid vaccines right now and not open it up for everyone?
No. Taking booster is open for everybody. If anybody is traveling outside, if the person is high risk group, those who can go and buy and pay, they can have this booster
No,
dose.
but it's not open
But
for everybody, no, because somebody who cannot afford even to pay this much, 225 plus the 150 rupees, will not be able to go and take it. So it's not open for everybody.
no, I am saying it's not open for everybody. Those who are high risk group and those uh, those uh, those basically the hospital workers and everybody, they can get. It is available in the open market as per my information. I have not got the complete info. That is why I am not able to correctly confirm it. But in my opinion, whatever the advice of COVID expert group is there, we are doing the same.
Okay. Dr. Sunil Agar, coming back to you, can you shed some light on, your assessment of the situation as to why this difference is there and why this policy has been put out like this, where it is only paid boosters that are available, taking away the choice entirely from those who can't afford it but want to get the boosters?
I think, Avni, let me be a little very candid on this
Yes.
issue and very frank issue. That as I said, the government has come a long way in terms of vaccination drive, and over a period of time, looking at the needs of the people, the policies have been changed. And earlier, if I remember, the private sector demanded in a big way that they want to give the vaccine, but they could not give because people were not going over there. They found that the vaccines were lying, unutilized over there. So that's why, the government said that we will be now bearing about 75% of the vaccination costs we will be bearing. So ultimately, that was a decision which was taken by the government, and that is how, and still, we found that majority of the vaccines which were given to the private sector were lying unutilized. So that is where we have to see that, now, basically the costs of the vaccines are quite subsidized. It's not everybody is going to take the vaccine tomorrow. That is one thing. We have to wait and watch. The policy will change as per period of time. What we have to keep in mind is now frontline workers, healthcare workers, people who are more than 60 years of age, they are being provided vaccines, the boosters or precautionary doses free of cost. So over a period of time as we move ahead. But another thing what we have to say is that free business always does not work. That is one thing which we have to see that and keep that in mind. Because as I said, the vaccines under Universal Immunization Program are provided, 9 compulsory vaccines are provided free of cost, but people still can take from private. So that means their affordability as well. So we have to see that, we are talking about now subsidized vaccines. We are talking about, at the cost of 250 rupees. Not everybody is going to take tomorrow. The strategy will change over a period of time. But there is something what we know as community participation as well. What is the responsibility of the community? Every time we cannot have free business. That is important. We have to see that the systems cost, the healthcare, machinery cost. So we have to keep that in mind. But we have to wait and watch. And over a period of time, I'm sure, the decisions will be taken, particularly for people who are below poverty line, and they will be provided vaccines free of cost, because we are doing that in all other programs as well.
Right. Dr. Garg, I agree with you to some extent, but Dr. Gilada, coming to you here, Dr. Garg said you can't have free all the time. But the point here with regard to vaccines is, even in Parliament, this question was put up about high fuel taxes. And, the answer that was given, official answer that was given, was the fact that high fuel taxes are there so that things like the free vaccine program can be carried out. But at this point in time, it seems like the boosters are not being made free, at least for the time being. I don't know about what's going to happen in the future. The taxes are also high. But the point really is that while, yes, there are a lot of other things to take into account, should it not be just a fair, kind of policy for everyone and leave the choice up to whoever wants to or doesn't want to take the booster?
Avni, firstly, I will salute to you for taking up this issue. Let people understand one thing, that first you give them free, you make people habituated to free, and then you blame them that people are habituated to free. Who had asked to give entirely free? It was a sole decision of the government at that time, and we admire that decision. If you look at the costing of the vaccination for the entire year, it is less than 1% of total budget. So it is not very high cost what we have incurred. But at the same time, by doing that, we prevented a lot of people from getting infected, a lot of people from getting into hospitalization, ICU, or dead. So I think we prevented a lot of deaths and comorbidities and morbidities due to COVID. And therefore, today we can say that India is better. And that's the reason we could do such a good vaccination. But at the same time, another thing is that when you say private sector has not utilized the vaccine, that is wrong. Your definition of private sector is wrong. Because what you given was private sector means only top big private hospitals, not private practitioners, not nursing homes, not small kind of hospitals. So vaccination was never given to them. Thirdly, another doctor colleague from the BJP was saying that now vaccine will be available in the market. No, it is not available in market. So it will be all by the portal of CoWIN portal. So you'll have to go to those centers who have a CoWIN portal on their platform. Then only they can give vaccine. So vaccine is number one, not available in market. So let people do not have a misunderstanding. It will be at the same vaccination center it is happening currently at the private sector. It will be possible that Government of India and the state government may consider to provide vaccination at the designated government vaccination center free of charge, and that may be taken next week. They should have done something for those which are with comorbidity, whether 45 plus comorbidity or 18 plus comorbidity, so that they can give, they are given that benefit of preventing infection. And lastly, vaccination is best done when any kind of infection is lying low. And this is the currently best time, whether you do primary vaccination or whether you do booster vaccination, this is the best time because people are not infected. Daily infection rate of recorded case are only 1,000, and there is no confusion even if your vaccine is given. When the COVID is up and when you are giving vaccine, somebody is incubating the COVID, somebody is having the COVID and you are giving vaccination, you are creating a problem in that person by having a cytokine storm. So I think best time to do vaccination is any infection is lying low, and currently is the best time.
Dr. Gar, coming back to you, you said this is the time for the community to stand up, for people to stand up and, take decisions at this point. The government can't keep doing everything. Can you elaborate on that? What exactly do you mean at this point?
See, that is where I'm telling you that primarily we required 2 doses of vaccine. And on top of it, we have also suffered from infection, number one. Number two is that now, gradually as we are, as has been mentioned, that we are getting all-time low number of cases, and our seropositivity is somewhere around, total seropositivity is around 5.4%, but, per day positivity is somewhere around 1%, if I was to say that. So, when I was to say that, there is something what we call in any program, whether it's a TB program, whether we call it as mother and child program, so services are made available, but there is something where the community has to stand up and bear the cost as well. It cannot be universal, though health is a state subject. We are already providing services free of cost to
But Dr. Gar, the community is bearing the cost. Those who can afford it are going to go and take the boosters. That is precisely the point. Nobody is saying that those who can't afford it should not pay. Yes, I will pay to get the booster, but somebody who cannot afford it, what about that person?
Avni, that is what I'm telling. Over a period of time, let's move. It's only yesterday we have made a big announcement that we are opening. First of all, the question is that NTG has taken the decision that we will open out to everyone. And number two, we have to make sure also, why I'm telling you again and again is that people who have taken 2 doses and they have suffered from infection. As of now, if you will say that they are that's why we are having such low level of infections. You see, where in our neighborhood, we are having China suffering from a lot of infections, Europe, which is dependent upon boosters, or America, boosters upon boosters. Time will come where we will have to have a relook at our own vaccines. Boosters are not the answers. Let me tell you that. So we have to keep that in mind from the science perspective. We have to have a relook at the vaccines. We have to have a relook at whether we cannot afford to that after 9 months, 1 booster, then again another booster, because this is only going to stimulate your only B cell, not the T cell response. So we have to keep that in mind. Over a period of time, the science has shown us, and we are changing in our strategies also. So you see, people who are most vulnerable, that means 60 plus, are being provided free of cost. And has been mentioned earlier also that basically, people who are suffering from comorbids, definitely if they can afford it, they can take it. But those who are below poverty line, this we are doing for all the programs. It's not only that we are going to vaccination. people who are below poverty line under Ayushman Bharat. In any case, they provided services free of cost. And as also, we have to see that, and they're being compensated. There are lists of 1,490, investigations or management which are being provided free of cost to people. That is there under Ayushman Bharat. So we have to keep that in mind, and we have to wait and watch as to how we go ahead and how the program proceeds. It's not tomorrow, because we have taken, from 16 January onward till today, that where we have been talking about 180 crore individuals who have been vaccinated.
Right. So Dr. Garg, you're saying that, there's more data also that's awaited as far as boosters are concerned, and it's not the answer or not the solution. Then my question to that would be, why open it up at all in that case? But let me go back to Dr. Mishra here as well. Dr. Mishra, any indication that you can give us as to what is going to be the road forward in terms of the relook at this particular policy, whether it is going to be opened up, boosters, and the continued policy for what it is for frontline workers, healthcare workers, and the 60-plus age group? Is that going to continue for the 18-plus as well at government hospitals? Any indication?
I said that this is a scientific thing, and I cannot promise on the behalf of government that something will be rolled on or not until it is not announced, first of all. And you know that high-risk group and those who are needy, they must be given, and they are given free of cost. Even the booster will come. In near future, you will see those who needed it, they will be given free of cost. But still the data is not very clear that whether the booster is helping for normal population or not. The data is still in very nascent stage. In future, if the scientific group of COVID advises that yes, we should go ahead for the whole country, we will go ahead for whole country, as we have done in the first dose and second dose. Now that it is regarding the booster, because all over world there is no data suggesting that booster is protecting or not protecting, no clear-cut data. There are very few elementary reports are there, but no clear-cut guidelines. That is why it is rolled on only for the high-risk group, old age group, and frontline worker. And in near future, if it is needed for the society, yes, I can say that government will roll down in the free of cost.
Right. Dr. Gilada, coming to you, both Dr. Garg and Dr. Mishra are saying there is not enough data to sort of justify the utility of a booster. How useful is it? How much of a difference does it actually make? What is your assessment? Because we know other countries are giving boosters free of cost. It has been rolled out everywhere else as well. The question is, if we still have questions over the usefulness of a booster, then why roll it out to the above 18 age group in the first place?
See, no two countries, no two timelines, no two boosters, no two vaccines, they are similar. The situations are different. Secondly, if we say that COVID is a new infection, yes, I agree with both the speakers that it is a new disease. We understand very little, and day by day we are trying to unfold. However, for COVID booster or vaccination, after the second dose, after 6 to 9 months, the vaccine immunity goes down. However, what we check is only one type of immunity. We do not check the memory cell. We do not check the T cell immunity. There are a lot of tests are not available. So we have just an indication that after 9 months, on an average, the immunity goes down. Therefore, if at all the third dose is required, that would be a booster. However, if you take a look at flu, every year you give a different flu vaccine depending on what flu strains are available in that particular year. So rather than calling it booster, it will be kind of an annual dose. Maybe it will be part of the flu itself. They will include COVID also into the flu vaccine. And if the cost is low, like for example, both the companies have slashed down the prices. They cut down the profit margin. It is not that they are going to do charity, but they cut down the profit margin. In that sense, people can afford. So usually what we see in the strain, or what you call stream going to the hospitals is 50-50, 60-40. People want to go to private and government. It can be 40-60, but in vaccination, it was like 90-10 or 80-20. In that situation, if the cost goes down, possibly it could be again 50-50 or 60-40, and people would be able to afford to buy the vaccine rather than going and spending time in the queue where there will be a lot of time. And lastly, we need to shell off all these vertical facilities, whether they are jumbo centers where crores of rent is given to those people who created, or the vertical center of vaccination. They should be available in blood banks, they should be available in clinic, they should be available in nursing home, they should be available in your only doctor. You don't have to go anywhere. You just go for your checkup, and at the same time you can take vaccine. And that should be the part of the whole strategy.
Right, absolutely. All right, I'm afraid we're completely out of time, but Dr. Mishra, Dr. Gilada and Dr. Sunila Garg, thank you so much for joining us with your perspective. We, of course, have to wait and see how this policy really rolls out going forward. We'll keep track of that.
Thank you.